Welcome to our newest edition of an informative discussion on COVID-19 with Guthrie, Magic FM, and WYDC TV Big Fox. I'm your host, Frank Acom, and again we are joined by an expert panel from Guthrie. So if you could please introduce yourselves and tell us your role at Guthrie.
Hi, I'm Larry Sampson. I'm the Chairman of Surgery for Guthrie Healthcare System.
And I'm Mike Scalzone, the Executive Vice President and Chief Quality Officer for Guthrie.
And I'm Fred Bloom. I'm a family physician and the president of Guthrie Medical Group.
Well, thanks again for being a part of this. I want to start right off. We're all curious about the trends and what this means in our region and what COVID-19 cases are doing in our region. Could you fill us in, Dr. Scalzone?
Certainly. So it's been about 2 months or a little bit more since the pandemic really reached us. And earlier, as we've talked about this through the weeks, we really talked mostly about preparation for a potential surge of patients. And we're really grateful that we had not seen a surge of patients. And in the area, we've seen fewer and fewer cases in the hospital and fewer positive tests, so fewer people being infected. That's allowed us to resume some of the more routine, normal care that our patients need. So we're really in the process of having dual systems of care, taking care of our patients with COVID and their needs, as well as our routine patients and their needs. So that's what's happening now as the regions and the states that we are in begin to open up a little bit.
And with that relaxation of some of the restrictions, what precautions should people still be taking to make sure that we don't have a setback?
Well, it's a good point because the pandemic is not over yet. We do know that although our area has not been impacted as much as others, as we begin to be more active in the community, some of the same actions are still important, such as social distancing, avoiding large groups, good hand hygiene, and wearing a mask in public.
And so that's for us to stay safe. Now, what about you at Guthrie Hospitals? How do you bring back appointments? How do you prepare for that kind of thing? This is all kind of uncharted territory, isn't it?
It is, and we've spent a lot of time over the course of the last couple of months preparing for having more and more patients come to our offices. We currently have almost as many patients coming to our offices as we did prior to the COVID pandemic, and we've spent a lot of time making sure that our facilities are safe for our patients to come back. So we have changed some of the processes when patients check in or how the waiting rooms are set up. We screen all of our patients for both temperature and questions about whether they've been exposed or infected, and we make sure that we maintain social distancing at all times.
Now let's talk about the emergency rooms, because I know there was some national news recently where people were concerned that people that were having emergencies were ignoring the signs. Are they safe to visit currently, and what kind of precautions are being taken in the emergency rooms?
So our emergency rooms are safe to visit. And it's interesting that when we saw volumes in the emergency room go down, many people thought that was a good thing. We thought fewer people were getting ill. And what we realized over time is that actually people were deferring their care. They weren't coming in for the necessary care, whether that was symptoms of a heart attack or a stroke. And we needed to let them know that our facilities are safe. And if you're having those kind of emergency symptoms, please don't hesitate. Call your provider or come immediately to the emergency room. Again, we have special areas that are designed to take care of patients that have symptoms that may be related to COVID, and other areas where we take care of patients that have other emergency conditions. And so we are prepared from both a staffing standpoint and a facility standpoint to take care of all patients that come and need emergency care.
Since this is all unprecedented and no one's really sure how this is going to play out, obviously, but people are talking about a resurgence in the fall, and you just previously touched on kind of a resurgence. What is Guthrie doing to prepare for that possibility?
Well, we know that every fall, as flu season begins, we do see more people coming to the emergency room. We see more people being admitted to hospital with respiratory infections. And so as this year comes, we have to be especially prepared. And for us, that means a few things. First and foremost, we want to encourage everyone to make sure they get a flu vaccine when it's time, because any other respiratory disease we can prevent. That's very important. Secondly, we're making sure we have adequate supplies. And so if you recall, in the beginning of this pandemic, people were very concerned there'd be enough supplies to take care of our patients. So we've been spending a lot of effort and a lot of time to make sure if there are more patients needing care, we are prepared and we have the supplies to do that. So there are a number of things like that we're doing to make sure we can take care of extra patients should that be needed at the time of the fall.
Now, I want to ask Dr. Bloom, I saw a recent study that showed that nearly half of Americans stressing and skipping medical appointments. This is what the survey said, kind of piggyback on what we were just talking about with Dr. Scalzone. You being a practicing family medicine physician, can you elaborate on why it's important to come in for the routine care that patients may have been putting off in these times?
Frank, that's a really important point. When we thought that COVID was just going to last a few weeks, it's okay for people to put off many things for a few weeks. But we now know that the COVID-19 pandemic is going to last months. It may be a year or more before it finally goes away, till we have a vaccine where we can completely eliminate COVID from our communities. And there are not very many things that can go months without medical treatment. We don't want infants to get behind by months on their immunizations. We don't want people with high blood pressure or diabetes to go months without having good care and good control of their chronic medical conditions. Even for things like cancer screening, a woman who might have a breast cancer, we don't want to delay that diagnosis for months by not having a mammogram done, or a man who needs a colonoscopy to not find that colon cancer until months later. So there are very few things that we would say you should put off for months. And we are encouraging people to return to our medical offices, to call your physician, to get those appointments set up so that you can have that ongoing medical care that's so important.
And what would you say to the person that's viewing this that is anxious? You know, obviously we're all a little scared in our day-to-day routine. What would you say to them about resuming their scheduled appointments?
So we've done a lot in our ambulatory offices to make it safe for you to come and see your provider. We have oftentimes segregated the patients so that the sick patients are cared for in one area and the healthy patients in another area. Or maybe in the mornings, the healthy patients come in and the sicker patients come in the afternoon. In smaller offices, we've done a lot to change the check-in process so that we have very few patients in our waiting rooms. Sometimes we'll check people in from their cars and have them come directly into the examination room. When patients come in, we're doing screening questions and screening temperatures to make sure that if there is a patient who may be ill, that we identify that right away, isolate that patient, and eliminate contact with other patients. We all are wearing masks in the offices. We're having patients continue to wear masks in the offices. We're doing increased cleaning and disinfecting of all of our examination rooms. And we're reducing the number of visitors and accompanying family members in our offices to try to reduce the overall number of patients in all of our offices, all to make it a safe place for you to come for that necessary care.
And let's talk a moment about telemedicine, because in the amazing times that we live in, we've got the technology where you can have both children and adults use telemedicine. Can you talk about that?
That's a great option for people. We now have the ability to reach out to people via telemedicine and have a video visit, like a FaceTime visit with your physician. These visits are now covered by most insurance plans, and you can have the same type of a visit with your provider as a face-to-face visit. The visits are very easily accessed through our Guthrie portal. Our nurse helps you to get logged into our virtual waiting room, and then you have the visit with your physician. And a large number of things that we used to have you come into the office for, we can now have done virtually.
What are some of the things that I can look at if I need care for telemedicine? Are we talking routine follow-ups, those type of things, sick visits?
So many acute and chronic problems can be taken care of with a telemedicine appointment. We have a Guthrie Now app, and with Guthrie Now, for urgent medical problems that are minor, you can access through your cell phone a provider who can give you convenient care face-to-face. For those things that are more chronic medical problems, it can be accessed in your diabetes appointment, your high blood pressure appointment, your routine follow-ups. Many of those can be accessed now through telemedicine.
Is it a pretty smooth process? Because I know here at work, some of the FaceTime and Zoom meetings aren't always perfect. Is it a little bit better with telemedicine?
So we have a lot of IT support as well as our nurses, our office nurses, to help you get connected and help it make it a smooth process. Just like when you come to the office, an office nurse helps you with the rooming process and get you ready to see the physician, we now have our office nurses reaching out to you by phone, making sure you're able to connect, whether it's on your cell phone or on your computer, or on your tablet, to have a very good connection and have that telemedicine visit work successfully.
What an amazing time. And one of the trends that we've talked about so far on the program has been safety, whether it's safety in the hospital, you're cleaning, you're doing the whole process, or whether it's our own personal safety. So Dr. Sampson, I'd like to get you involved here. Let's talk about non-emergent surgeries and what precautions are being taken as Guthrie starts to bring back patients for non-emergent surgeries.
So every person that comes into the hospital, whether it's an employee or a patient or anyone, is screened with a temperature, a symptom check every day. And if you leave the hospital for lunch, you're screened again. So personally, I feel much more safe in the hospital setting than any other setting in my life. I do not worry when I come to work at the hospital. I do worry when I go out buying groceries. Rational or not, I do worry in other settings.
Why are visitor restrictions important at this time? I know that a lot of people have been talking about that. Could you tell us about that?
So it's to decrease the absolute number of people coming in and out of the hospital. So it is another way of assuring the safety of our patients.
And I would add to that we still have state guidance on those type of activities. So the states have regulations through executive orders that we follow, because those executive orders are informed by the CDC and the experts there. So in some cases, and visitor restrictions is one of them, we have guidance from external agencies that we follow.
And what should a patient know, someone that's coming in? When you say visitor restrictions, you're not, like in the old days, let's face it, people would come with their whole family sometimes. It's not that any longer.
So much of the time, we would ask that visitors not come. There are certain circumstances in which it is critical that a visitor be there. Those would be the rare end-of-life circumstance, deliveries, I believe, for a short period of time.
Yes.
So these critical points in life, we do have visitors come. And that too is consistent with national guidelines. We are working on electronic ways to enhance communication between patients and providers and their families. We are working on them, and they will be coming.
So very similar to telemedicine, where they'll, whether your phone or video calls, tablets, things like that, be able to visit online.
Absolutely. Yes, it's very exciting, really.
Well, it's an amazing time. I want to go back to telemedicine here because I want to stress the importance of it. It gives an opportunity, as we were talking about. Some people are anxious. Like you said, maybe it's not reasonable. We're anxious to go to the grocery store. We're anxious to go to the doctors. So telemedicine has really opened up a new door for you at Guthrie.
And I don't think it's going to go away. I think telemedicine is going to be a part of care long beyond the COVID pandemic. We're now learning that telemedicine makes it much more convenient to have this physician appointment that you haven't been able to have in that same way before. And I think people are going to get used to it and like that and want to have continued telemedicine visits even after the COVID-19 pandemic has gone away.
And this question is really for anybody. Do you feel a lot of the procedures that you're following now will be here long after coronavirus?
I think it's hard to predict, but I have little doubt that most of these safety precautions that are in place in one form or another will persist, and that we will have a slightly different way of caring for patients. With every serious issue like that, you try to find the silver lining, and I think some of the things we've learned, perhaps it's use of telemedicine or other aspects about surgery, will really help us deliver better care after we come out the other side of this pandemic.
And it seems like, I could be wrong on this is a prediction, but it seems like after coronavirus, people are still going to be washing their hands and they're still going to be involved in the cleaning process because that's all ingrained in us now.
Yes, I hope so. I think that's always been an important part of what we do in the healthcare system, and again, nice to see that something positive will come out of this.
Right, and I do believe there's a lot of technology and a lot of the safety that will stay long after coronavirus, and that is maybe a silver lining. What's your reaction, Ben, to the outpouring from the community? It seems like there's a lot of thank yous, at least on Facebook and social media in general, but I know there's been some drive-by honkings and things like that. How's the community outreach, Ben?
So one of the reasons I love living in this area is the people have been supportive from the moment I arrived here in 1995. So I think our communities have been very supportive of us over years and years and years. I do, as a physician, I truly feel supported all the time. My wife is a nurse, and I think she is conscious of the increased support of nurses, and it has meant a huge amount to her. And I am grateful for that. Our nurses are fantastic and work incredibly hard and are very caring, and it is great seeing them supported.
We've asked a lot of our patients. We've asked a lot of our patients, a lot of changes that have been required in order to get care. And so it's been very heartwarming to see that they've been more than willing to be able to do that. We've also had overwhelming support from the community, some of the businesses in the community, individual patients, donors who have given personal protective equipment or money or other aspects to help us out.
The response really has been amazing and surprising in some ways. Providers who show up in the morning and they have in chalk on their front sidewalk of their office, "Thank you very much," written by anonymous patients and community members, to the parades that go around the hospital thanking us, to just the individual responses that we get from patients who are just so grateful to have support by Guthrie and the community. We have been really pleased at the response, and it really has driven us to do more and more and provide that care that you need and we want to provide.
And obviously you're on the front lines, but you mentioned nurses. How are the nurses handling all this? I know it's a stressful time, but with just the TLC they provide, they're doing such an amazing job and everybody's thanking them. How are they handling all of this?
Our staff have been amazing, from the nurses to the physicians to environmental services to folks that help to make sure that we safely provide for our patients, whether it's medications or food. It's been amazing how willing people have been to just step up. And they're really taking a chance here. And so we're grateful that they've been overwhelmingly supportive. And I think everyone is feeling like we're at a place now where we've gotten into a nice routine, if you will. We are very grateful that the surge didn't happen. We're now focusing on getting back to more of our routine care with these enhanced safety precautions. And I think that makes everyone feel a little bit better as spring arrives and we get a little bit nicer weather. So I think it's a nice timing for that to happen.
It really is. And it seems like people are more comfortable. But I want to stress again, I know we talked about this at the very beginning, but I want to stress again that people still need to practice the protocols. They still need the social distancing, correct? It's not just because the weather's nice doesn't mean we forget all of that.
No, that's absolutely important. Even as the states relax some of the restrictions, and even as the temptation of the nice weather to get out and to do more, large gatherings are still not safe to happen. Social distancing is still critical. If you're in public, wear a mask. Continue that hand hygiene. These are relatively simple things that can help protect the community, protect people's families, and protect themselves. And we really want to stress that that is important, even though we recognize it's still a little difficult in a situation as this.
I think paying attention to that scientific evidence, the recommendations of our state health departments, our state governments, the CDC, that's really what people should be paying attention to when they're trying to decide, how do I deal with the current pandemic and the level of risk in my area? I think there are going to be changes to recommendations on a daily or a weekly basis, and so you want to turn to those really scientific experts to help to give you that advice, rather than looking at some of the things that are on social media that sometimes can lead you astray.
Were you impressed, and this is for anyone, were you impressed with how quickly you were able to adapt at Guthrie, and really people were able to adapt in something that is so unprecedented?
I was, yes, I was impressed, truthfully. It's the administration and leadership here, along with everyone, really rose to the challenge, and it was, I don't want to neglect the tragic nature of the pandemic and sickness, but it was exciting to see my leadership perform so exceptionally well and organize to deal with the challenges. And a lot of that organization is going to be ready and there forever now. And so in the unlikely event a surge comes in fall, 2 years from now, 5 years from now, we'll be ready.
Before we go, and you guys had mentioned in a way this before, but what would you say to the community, whether it's safety tips or just a thank you? What would you say to the community that is still very frightful and fearful of the coronavirus pandemic?
I think first is a thank you. I think that the support that you have given to all of the healthcare providers through this pandemic has been the most important thing that we could have hoped for. To be able to know that the community is behind Guthrie and behind us as providers is really, really important, and I thank you very much for that.
And I'd say stay safe. As we spoke about, it's very tempting now as the weather changes and as there are some restrictions in each state on some businesses and activities. Stay safe. Do those wise precautions that the experts recommend in order to keep yourself, your family, and everyone around you safe.
I'd say remember social distancing, lots and lots of hand washing, face mask, and you can still have fun. And I would say thank you very much to the community. We don't exist without you. And similarly, we exist for you. We're very linked to you. And Guthrie at large, and I personally am grateful for the community support over so many years.
Dr. Bloom, just before we go, I want to stress the telemedicine aspect because I think it's so needed right now and so many people feel more comfortable with telemedicine. What should they know if they've never used it before and how they can get involved in telemedicine?
So, first of all, a lot of people are just worried that they're not IT savvy. They don't know exactly how to use a lot of different apps and things. You don't need to. If you have a cell phone that you can do a FaceTime on, if you have an iPad, if you have a home computer, we can make it work for you. And so give it a try the first time. We will walk you through it, and then you'll find that it's something that you can use to communicate with your providers forever going forward. So give it a try, and we'll help you to make sure that you're successful.
So there's no reason to wait. Everybody should jump on this because it's such an amazing opportunity. Like I said, we live in amazing times, and this makes it all the more easy. I know I stressed this last time, but I want to, again, thank you for the work that you've done and your staff, of course, like we mentioned earlier. Guthrie, all you've done to keep us safe and keep us healthy. So thank you.
Thank you.
Thank you.
Thank you.
Dr. Scalzone, Dr. Bloom, and Dr. Sampson, I really appreciate you taking time out of your busy schedules to be part of the program, and thank everybody for tuning in and watching an informative discussion on COVID-19 with Guthrie, Magic FM, and WYDC TV, Big Fox. Stay safe, and thanks again, guys.